Hello and welcome again to the Quality Improvement Training Series on root cause analysis techniques, helping identify causes and solutions. My name is Mary Beth Cox and I am your facilitator for this series. This is the fifth and final video in this particular series. Previous videos have focused on preparing to do root cause analysis and root cause analysis techniques and tools, including brainstorming, 5 whys, check sheets, and Pareto charts. In this video, we will be discussing how to move from identifying the causes to identifying solutions. Throughout this series, we have worked to identify and describe a number of root cause analysis techniques and strategies. We began with brainstorming and then moved on to how to use the ideas from brainstorming to organize your ideas into affinity diagrams and fishbone diagrams. We then moved on to explore the techniques of the 5 whys and the why tree. And finally, we moved into counting our causes to help identify those that happen the most often using check sheets, histograms, and Pareto charts. So here we have arrived at identifying our causes. So let's talk about how to use our causes to then move to identifying solutions, which will become your changes to test using the Plan, Do, Study, Act cycle. In doing your root cause analysis, you likely identified a number of causes of the problem at hand. So the question will arise, which cause should you focus on? Here are some factors to consider. First, you may want to consider addressing those causes that have the highest frequency, such as those that affect the most people or happen the most often. You may also want to consider addressing those causes with the most severe impact. This would be causes where the cost of doing nothing to address that cause is high, or there is an urgent need to address it. An example of this would be in the example we looked at of causes of level 2 and level 3 falls. There was a relatively low occurrence of the cause that individuals' fall plans were not being followed, but the cost of not addressing that may be high. So perhaps the team would decide there is an urgent need to address that, even though the frequency was low. Finally, you may want to look at causes with easy solutions that you can do now. In the same example, when we looked at causes of falls, replacing a shower curtain is likely an easy solution that an organization could make happen quickly and help address the problem. So once you've identified which causes you want to focus on, you then need to think about which solutions should you select. Again, these will be your changes to test using the Plan, Do, Study, Act cycle in the model for improvement. Here are some factors to consider. You could consider focusing on solutions that will have the largest impact on people, processes, outcomes, etc. You could also focus on solutions that are achievable, realistic, and for which you have the resources. These are important decisions that your team is going to have to think through and decide together. Here is a list of tools and strategies that can help you and your team identify and select solutions or changes to test. First, you could review the best available evidence for what works to address your problem. You could look in the literature and look to evidence-based practices in places like journal articles. You could look to existing guidelines, manuals, instructions, and process maps for ideas. You could look to your peers or other experts in the field who have had success. In the world of quality improvement, these are often referred to as bright spots. people and organizations who have already figured it out. How can you learn from what they have already done and apply it to your organization? This is also sometimes referred to as stealing shamelessly from other states and similar institutions. Of course, we don't want to violate any copyright laws or anything like that, but if something has been found to be a good practice, reach out to that organization or entity and learn from what they have done, and perhaps they can serve as one of your subject matter experts. You can use your root cause analysis itself. It's likely that the process of identifying the causes of your problem also helps reveal some possible solutions. You could use an existing driver diagram or create your own. A driver diagram is a visual display of a team's theory of what drives or contributes to the achievement of a project aim. One place to learn how to create a driver diagram is the Institute for Healthcare Improvement Quality Improvement Essentials Toolkit. You could use creative thinking and problem-solving techniques like brainstorming to identify solutions to your problem. And if you have multiple potential solutions and the team is struggling or needs to select one to focus on first, you could use team-based decision-making strategies to select one change, such as voting, using a pro and con list, ranking your votes, using a cost-impact analysis or matrix. Finally, you could ask your key stakeholders for input on solutions that you could change or test. You could use surveys, focus groups, and key informant interviews to get their ideas. This is a list of potential change ideas within different categories that I have created over the years as a result of working with public health and other human service organizations to select changes in quality improvement projects. So you'll see the 4 categories that are here are standardize internal policies and practices, build the capacity of and support for staff to address the issue at hand, create community linkages and support systems related to the topic, and engage individuals and families in your work. So within each of these is basically a menu of ideas that you could consider as you are selecting changes for your project. For example, under standardizing internal policies and practices, this includes developing and adopting policies and procedures related to the topic that you're interested in. Other ideas here include streamlining related processes to increase effectiveness or efficiency, and having approved, available, and accessible print and electronic materials related to your topic. Within the category of building capacity and for support for staff, ideas include establishing training requirements and content, establishing data to use for quality improvement and sharing those measures and data with staff, having ticklers and reminders for using screening or assessment tools on a schedule if that's something you need to improve, and promoting team-based care and practices. Under creating community linkages and support systems related to the topic, some ideas would be to establish cooperative relationships with key community partners and potentially with support groups, closing the loop of communication for things like referrals and other processes for accessing or engaging in services, and having up-to-date topic-related resource lists. And under the category of engaging individuals and families, changes, ideas include helping the individual to feel or become empowered to meet their goal, using best practice or evidence-informed strategies to enhance practices on the topic, specifically for individuals and families, using an evidence-based curriculum with families, using effective counseling strategies, considering peer-to-peer strategies, and using practices and resources to strengthen the family support systems. So these are just some ideas to look through and see if any of these would work for you to test to address your problem you have identified. So if you want to, you could take a screenshot of this and keep it handy for your use. So let's return to our toothbrushing example for what this might look like. So our problem was that my kids forget to brush their teeth many nights. The key causes that we identified from our root cause analysis were forgetfulness and having a routine where brushing their teeth comes after putting on pajamas. So we decided to use brainstorming to identify solutions to address these causes, and then we're going to vote on the ideas to select the winning one. So you can see in these thought bubbles the brainstorm solutions that our family came up with, including taking memory pills, having a big picture of a toothbrush on the stairs as a cue, creating a machine to brush your teeth in bed, one parent quitting their job so they won't be so tired and forgetful, putting up a gate that you can't cross until you brush your teeth, setting a reminder on the Echo Dot, Dad becoming the official toothbrush officer, and setting a new rule: no pajamas until you brush your teeth. So you can see the results of our voting with the gold stars. The first place winner was setting a reminder on the Echo Dot. And then the second place was setting a new rule to not put your pajamas on until you brush your teeth. And then we also had one vote for Dad becoming the official toothbrush officer. So it looks like we are going to try setting the reminder on the Echo Dot first. So here we're taking our next step of plugging in our information into the model for improvement and answering our 3 questions: aim, measure, and change. So we've set our aim here. In 3 months, I want to increase the percent of the time my kids remember to brush their teeth from 49% to 80%. If you remember when we collected our baseline data using a check sheet, the percent of forgetfulness was 51%, so the percent of remembering was 49%. So I framed it this way so that an increase was the desirable direction. For our measure, we will continue to measure the number of times the kids forget to brush their teeth daily using a check sheet. And we've identified the changes we want to test from our voting and brainstorming method. So first, we're going to test the reminder strategy. We will set a reminder on our Echo Dot for the children to brush their teeth at 7:45 before they go to bed. And you can see I've listed our other changes, but we are not going to test those yet. We are going to start with one change and test it first. Finally, you will take this information and start your plan in your PDSA cycle. So our plan for our change is that we will try this for the next 1 week and track our data to see if our data have begun to improve. On this slide, we're looking back over our example on preventing falls to look at all of the root causes that were identified in that process. So those listed at the top were those identified as the most common or frequent causes of level 2 and level 3 falls from our Pareto chart. And we've used each one to identify some potential change ideas or solutions to try using the Plan, Do, Study, Act cycle. So those are listed on the right-hand side. At the bottom, we've also identified other root causes from our fishbone diagram, our 5 whys, and our affinity diagram exercises. So we've also identified some potential change ideas for those as well. As a result of reviewing these, we can imagine that our team identified that we wanted to work on those that have the stars beside them. We want to help reduce falls among individuals taking 4 or more medications. So we would look at testing those change ideas. We want to definitely address that pesky rug and remove or secure all rugs. And we want to address the issue of people needing but not having a fall prevention plan and making sure that those are in place for individuals that need them. We also decided as a team that because it's a relatively easy thing to do and can have a serious impact if it's not addressed, is to fix that loose handrail that was identified as a cause of level 1 falls. So if this was something your team went through and identified all of these causes and change ideas and selected these 4 to test, you might want to still keep this in your folder because once those changes are implemented, you could come back and look at the other work you did and revisit if you want to then implement any of these other changes. We've also been using the example of preventing falls throughout this training series. So here we've taken it to the next step of using the model for improvement and answering our 3 questions for preventing falls. We've set our aim that by the end of the year, we want to reduce the rate of falls by 10% from a baseline of 67 per 1,000 to 58 per 1,000. For our measure, we're going to measure the number and rate of level 1 and level 2 and 3 falls each week for the next 3 months using a check sheet to determine if there's been an improvement. And we will also calculate the rate each month so we can track our goal toward our aim. We've identified several changes that we want to test. First, we want to address our most prominent or prevalent cause of people with more than 4 medications falling at a high rate. So we want to ensure proper assessments and supports are in place for those people taking more than 4 medications and include make sure that they have an up-to-date risk awareness tool that is completed correctly. We also want to address some environmental causes we've identified, including removing and securing all rugs and repairing the handrail. And we want to work on fall plans to ensure that fall prevention plans are in place for all individuals that have indications. So we want to start planning our plan, do, study, act. So our plan is that we will remove rugs and repair the handrail by tomorrow. We will identify everybody taking 4 or more medications and make sure they have up-to-date assessments, including a risk awareness tool by next Friday. And we will review which individuals have indications for a fall prevention plan and ensure there is one in place by the end of the month. So as we are going through our plan, do, study, act cycle, we will note when each of those things are accomplished and also look at our data we're collecting to be able to see if, as we made these changes in sequential order, if any of them resulted in a shift or a change in our data. That brings us to the end of this video and the end of the series on root cause analysis strategies and techniques. Hopefully you have learned more about and now are able to use root cause analysis strategies that we reviewed in these videos, as well as using the causes that you identified and moving towards identifying and selecting solutions to then use in your plan, do, study, act cycles. Here are some resources that you can visit to learn more about the topics covered in today's video and the training series.